here. Here we have Maria. And hi, I'm Dr. Warwick here, and we're live here in Lacey, Olympia, Washington. I just wanted to briefly share with you that when you're experiencing degenerative type changes in your spine, where the spine and the discs start to wear away a little bit, that even the benefits of chiropractic and adjusting you can be helpful. Maria, just briefly share what your experience was.
Yeah, when I came to see Dr. Warwick, I was experiencing a lot of pain on my hands and my arms, and he explained to me that's because of some disc degeneration, and after his treatment, my pain has subsided substantially.
Thank you.
You're welcome.
Let's have you go face down. We're going to show you what we're doing with some of the conditions. Hopefully you guys can see this just a bit on there. It looks like the camera angle's off just a bit. And one of the things I look at is how much stress is going on in the body. So when you see a chiropractor looking at your posture, looking at the position of the body, how you lay down on the table, how you move, get up, those are all indications part of our exam. And one of the many things that we check for is an imbalance in the legs. So today she has at least a 3/4 of an inch short leg, and you can see how the hip rotates back on this side where it's a little bit higher, and the hip area is lower on the right side. So when we're looking at that, we're looking to see where the primary misalignments are, and we do certain tests by moving the body around or palpating or touching the area. And so we're going to begin adjusting the right SI joint, that's the pelvis or ilium on the right side right here. And I like to use the drop technique. One, it saves my back a little bit. Some of you wonder why docs use a drop or side position, because it saves our back too, and it's an effective technique. Sometimes people don't like being on their side. Both legs are even in position 1, 2, and 3, so a simple test to see the changes that are made in that area. I like to also do traction with mine to help hydrate the disc and also stretch the back. You don't mind this one, do you?
No.
Take a deep breath, release. Good. Good, and drop your left arm down toward the floor for me, and let your head just come to the side here. There you go. Thank you. Breathe. You bring your arms back up. We've been doing a lot of work up toward the cervical or neck area. I like to get across the muscles that tend to be between the shoulder blades, right at the top of the trapezius, right up here, relax that area before I start adjusting more. You saw me adjusting a couple of the ribs that I could feel out of place. Sometimes patients will complain, like something sharp sticking, or they're having a hard time taking a breath in. That's usually a rib misalignment. It can be the vertebrae as well, but most of the time I'll find when people describe or use those type of information to tell us it's usually a rib in that area. Maria,
Yeah?
this is the quietest you've been.
Huh? What?
This is the quietest you've been.
I don't know. Yeah, I'm just letting you do your work there.
Let's have you lay on your back. Can I say that what you do briefly, not for who, but what you do?
I am a flight attendant.
There you go. Is that a hard job?
Very physically.
Demanding,
Hard,
isn't
yeah.
it? Okay, so you see a lot of chiropractors, or some of the chiropractors, do types of adjustment where they use a towel or a pillowcase. I do that too. But many times, based on the body type that I feel in through here, I'll use my hands. So I actually do a traction. She's already gripping the table. To help open up the area in the lower portion of the neck. And I want you to gently push your right ear into my hand right here. Good. And relax it for me. Good. So we've been able to get a little bit deeper in that area of her neck, right where that degeneration is. Did you feel it release?
Mm-hmm.
There we go.
Before you adjusted me, you cracked on its own.
We got the crack before the actual crack, huh?
Yeah.
And you may notice one of the things that I may do different than maybe some other chiropractors practicing. I like to adjust full spine and full body. So I go through and check the various areas of the body, the bones in the body, because I think it all works as one. So many of the patients that come in get more service than they expect in the office.
More than they bargained for, right?
Yeah, usually that's a good way to look at it. That came out of the mouth of one of my patients, so I didn't pay her to say that. But it makes a difference. Okay, I'm gonna have you sit up and face the chair to your left for me. Okay, I want you to bend your head, tip your head, excuse me, hold on, you went a little quicker than me. Tip your head to the right and to the left. Back to the middle.
Actually, that's a lot better. It used to be a lot more painful there.
Bend your head forward for me. And bend it backward. Good, back to the middle.
That's much better when I go back to.
You've had a lot more range of motion in there.
Yeah.
Turn your head right. Nope, turn it.
Oh, turn?
Turn
Okay, got it.
and left.
That's better too.
And back to the middle.
See, when I turn here, that's where I get that.
That pulling?
Yeah,
Where? Show me where again?
right here. It goes like
Right
this.
through that?
Yeah.
What do you feel there? Like a shooting pain?
It's almost like a headache, it's a deferred pain, no doubt about it, but as soon as you put pressure here, I feel it right here.
Okay, cranial nerve, and that's referred pain that you're talking about there,
Mm-hmm.
usually related to the pressure point. I want you to bring your arm out for me, hold it right there. I'm going to add pressure to the vertebrae, so I'm pressing on C1, and see how your arm goes a little weaker right there?
Yeah.
So we're going to adjust C1, take a breath in, release it out. Good. I want you to hold the arm out right here, hold, resist me. Good. So stronger there. Now we're going to check C2. Let's check the other arm. Hold it out. Resist. So we're checking C2. And then we go a little bit further down her neck. Let's switch again so we don't get fatigue on there. You're nice and strong through here. See the difference?
Yeah, I
Okay.
can hold it better.
Strong in through there. Okay, so arch into the lower back. Shoulder blades back slightly. And I want you to retract your chin back right like this. Take a few deep breaths in and out through your nose, out through your mouth. So the ear is in alignment with the shoulder and the shoulder is alignment with the hip. This is something that you guys can do when you're at your desk throughout the day or even standing or sitting in the car. Sit up straight, chest up, retract your shoulder blades. That means bring them backward and retract or move the head like parallel to the floor, straight back, as if it was on a even parallel plane on there. So by doing that, it takes that tension off the base of the neck and helps retrain the posture in that.
So do you have to arch your lower back a little bit when you do that?
You want to be aware of it. I mean, depending where you're sitting, that's a
You
good
don't want to go
question.
like this, but just
No,
so
just,
that you have your
I mean,
normal curvature.
yeah, just get a little, stop from slouching.
Okay.
You know, so you get a little bit of an arch here, bring the shoulder blades back, just to make yourself aware of it, and then retract the chin in. And you can take a few, breathe, hold that for, a second or two, or do it a series of times, like 8 or 10 times, where you retract it back in exercise. It's a good way to retrain your spine, because it's when you lose this curve here in the neck and the lower back, that's when your problems start.
Okay.
I'm Dr. David Warwick of Warwick Chiropractic. Thank you for watching. I hope you enjoyed this video and picked up a little tidbit here today. We'll see you next time.